An echocardiogram is an ultrasound we do on your heart to make sure it is pumping correctly and to make sure all the valves are working correctly. Sometimes your doctor will order an echo if you're having chest pain, shortness of breath, tightening in your chest. There's multiple things that doctors will order echoes for. When you come in for an echo, all we'll do is we'll have you come in this room. We'll get you to slip your shirt and bra off, lay down flat on the bed, on your back, and we will put 3 electrodes on you, one right here, and one on your stomach. And we'll hook you up to this machine. It's gonna take an EKG of you while I'm doing your echo. Okay. So today we're gonna do an echo on you. I'm gonna put 3 stickers, one right here, and one right here. I'm gonna hook you up to this machine. It's gonna produce an EKG while I'm doing your echo. Today I'm looking to make sure that the structure of your heart is good and to make sure it's pumping really well. I'm also going to check the valves for the doctors, and I will be just scanning right here and then right up underneath, right where your ribs are. Okay, now I'm going to step out. If you will just slip your shirt and bra off, lay flat on your back, and then I'm going to give you this gown. You'll just drape it over you like a blanket. Don't actually put it on, okay? Okay. And I'll be right back in. You're welcome. It's going to take about 30 to 45 minutes depending on how easily visible your heart is seen with ultrasound. If I cannot see the borders or walls of your heart, I will have to use contrast, which is just milky saline. We just get an IV hookup and we'll inject that at the very end. After we get done with your echo, you'll get dressed, wipe all the gel off of you, and then I will take you back up to the front desk. You'll check out, and you'll receive these results within 3 to 5 business days.
I'm Adam, I'm the nuclear medicine technologist here at Madison Memorial Hospital, and we're gonna take a few minutes and show you how we do a nuclear cardiac stress test.
My name is Christopher Lloyd. I'm an OB/OR tech on the mother-baby unit, and I'm gonna be the patient.
Before you come, we'll have you fast from midnight the night before, just so that we don't have a whole lot of intestinal activity to pick up the radioactivity that we'll put in your IV after we get it started. We'll have you hold your cardiac medications that you would normally take in the morning so that we can get your heart rate to the beats per minute that we want it, so that those medications aren't interfering with that. We'd like you to have comfortable clothes that you can walk on the treadmill in, good shoes if you're walking on the treadmill, so that you're comfortable while you do that. We would advise you to leave any valuables at home so that we don't lose them. That happens sometimes at the hospital. We'll have you have a seat right here for me. Okay. And we're just gonna start a little IV on you. So let me get my hands clean here. All right. I need a good vein. Where does a good vein live?
They say this is a pretty good one I got.
All right, bring that right up here. And I'm just gonna start a little IV. Perfect. We're gonna inject the radioactive stuff.
It's not gonna hurt, right?
Nope, this part doesn't hurt a bit. You might taste something a little bit funny. but other than that, we don't see any side effects. Now we'll wait about 45 minutes. We've done the resting injection. We'll wait 45 minutes for that to work its way into the heart muscle to see the blood flow to the heart muscle. Then we'll put you on the camera for about 8 minutes.
Alrighty, let's do it.
We'll have you lay down, feet down there, head right here.
Okay.
We're gonna get you in and under the camera. It's gonna go around you, then it'll go back around and take our pictures.
It doesn't hurt or nothing, right?
Nope. Nope, your job is just lay there and breathe normal.
Okay.
Okay? I am gonna put a couple little patches on you.
Okay.
Just to capture your heart rate. One up on your chest, one on each side of your ribs, okay?
Okay, cool.
It'll take just a second for it to get up and in. So once we get you in, it's about 7.5 minutes is all this scan is.
Okay.
Got it. All right, you doing okay right there?
Yeah.
Okay, off we go.
Okay, sounds good.
Let's so
So I'm coming to the treadmill?
yeah. So
Okay.
at this point, you can just have a seat here, Chris.
Okay.
And so at this point, what we do is we go ahead and hook up the EKG portion for the stress test. That's so that we can monitor the heart rate and the rhythm, because we do want to stress the heart just a little bit and see how they do. The easiest way to do that is to use the treadmill, which we have there. And so we'll put the EKG and the leads on and so that we can monitor them as they walk on the treadmill. We want to get their heart rate up a little bit just to see how it handles that stress. And it's based off their age, how high we get that up there. Usually it's about 5 to 10 minutes that they'll walk on the treadmill. And then once we're done with that, we'll come back over to the bed, watch them a little bit more, and then we hand them back over to radiology to finish the test.
If you can't do the treadmill for any reason, if you've got, a heart condition that doesn't allow, or hips or knees or ankles or feet that don't allow you to get on the treadmill, then we can use a chemical that gets the heart rate up and stresses the heart. It opens up all the arteries and veins. It's a good procedure. There are a few side effects that can happen. They are normal side effects, such as you can feel your heart rate going up. It might be a little more difficult to breathe because your body thinks you're exercising. All of your arteries and your veins and your whole body are opened up, and so you might feel flushed, maybe a little bit of a headache or some abdominal discomfort.
As far as hooking them up, what we'll do is we'll go ahead and have them take their shirt off if they're a male. If they're a female, we usually have a gown on them. Your hands on there, a little bit of support, and then we'll go ahead and start it here. I'll go ahead and fire it up and just kind of walk with it you'll feel it going up just a little bit, and you kind of see how fast it is and how high it is. It starts out pretty slow, 1.7 miles an hour. So it's not super fast. And it stays like that for 3 minutes, and then it gets a little bit faster and a little bit higher. But on the monitor, it'll show us all the rhythm and the how fast your heartbeat is and all that. Once that gets up to a target heart rate, then we'll go ahead and slow it down. Let you do a little cool down on there. We'll watch you for a few minutes. But also once it gets to that target heart rate, Adam will inject his isotope there as well.
Okay, just like the first one, we just hold that right there. You can even rest your hand right on the handlebar. We do that injection. And once we're injected, we'll have you exercise about 1 more minute. And then we'll put that into a cool down mode.
Yeah, and we just put this in a cool down mode. It kind of goes flat and slow. Let you do that for about a minute to kind of catch your breath. And then we'll go ahead and stop the belt, and I'll go ahead and stop that. Don't let it kind of startle you. It stops all at once.
Okay.
And then, and then we just have you come back over to the bed, and you can lay down, and we watch you for about another 5 minutes. And then at that point, I'm done. You're done in this room. I can go ahead and take everything off. And then it's back out to Adam to finish the test, the rest of the procedure.
Okay.
Okay, so after the stress, we wait about 30 minutes, and then we bring the patient back in and put them on the camera for the stress images. It's about 6 minutes of imaging, just like the first set, laying on the bed, and the camera going around you. After we're all finished, we take your IV out, and we'll walk you out to the front door. You can eat and drink as normal, unless your doctor has any restrictions that I don't know about. You can take any medications that you may have held, and the cardiologists from Idaho Heart are the ones that read these exams. Usually within 24 to 48 hours, your doctor will get those results, and you'll get those results from your physician.